Have you ever noticed someone you love starting to forget the little things? Maybe they misplace items more often, repeat the same question, or seem slightly confused in conversations. Slight memory loss can happen for many reasons. Sometimes it's normal aging, but sometimes it can be an early sign of cognitive decline or brain injury. Today, we're going to talk about when slight memory loss is normal, when it might be a signal of something more serious, and what families should watch out for. Memory changes are one of the most common reasons families begin to worry about neurological health. Slight memory loss can be associated with normal aging, but it can also be linked to cognitive decline, traumatic brain injury, dementia, or neurological disease such as chronic traumatic encephalopathy, often called a CTE. Understanding the difference between normal forgetfulness and neurological symptoms can help families know when it may be time to seek medical evaluation. Everyone forgets things sometimes. Normal memory lapses might include misplacing your keys or forgetting why you walked into a room, or maybe needing a reminder for a name or an appointment. But cognitive decline often looks different. Families may notice patterns such as repeating the same question several times, or difficulty following conversations, or trouble completing familiar tasks, or even confusion about time or place. These changes may suggest something deeper than typical forgetfulness. Memory loss can also be associated with brain injury. Traumatic brain injuries include repeated head trauma, and that can affect the brain's ability to process and store information. In some cases, repeated head impacts can contribute to chronic traumatic encephalopathy, or CTE, a progressive neurological condition that affects memory, behavior, and cognitive function. Families are often the first to notice subtle changes. Early signs of cognitive decline or neurological impairment can include increasing forgetfulness, mood or personality changes, difficulty concentrating, poor judgment or impulsive decisions, and difficulty organizing thoughts. These symptoms can appear gradually and be mistaken for stress or fatigue at first. If slight memory loss begins interfering with your daily life, it may be time to consult a healthcare professional. Doctors may evaluate memory changes using neurological exams, cognitive testing, and medical imaging. Early evaluation can help identify conditions such as traumatic brain injury, neurodegenerative disease like dementia, or chronic traumatic encephalopathy risk factors. Families caring for someone with neurological changes can face uncertainty and fear. Understanding the early signs of cognitive decline can help caregivers advocate and properly evaluate for support. Education is one of the most powerful tools families have when navigating brain injury or neurological conditions. If you're noticing memory changes in someone you care about, you are not alone. Many families face questions about memory loss, cognitive decline, and brain health. At Robbins Nest Alliance, we provide education and resources for families navigating brain injury, dementia, and neurological caregiving. You can learn more at robbinsnestalliance.com and explore additional videos, research on CTE, and caregiver support. Through our own experience living with neurological injury, we've seen firsthand how subtle changes can appear long before a diagnosis. I'm Heather with Robbins Nest Alliance. Thank you.